Can you imagine you or your loved one getting diagnosed with a terminal illness and not knowing what to do? Can you imagine going back and forth to the hospital constantly and no one's really kind of giving you a straight answer or taking the time to educate you on the services that you need? We get this all the time. One of the things that's a common question that we see a lot is the difference between hospice and palliative care. And what does that even mean? So what me and my wife decided to do is we decided to, at the end of a day, turn on the camera and just talk. So this podcast is really explaining the difference between hospice and palliative care. And this is the first part. My wife, who is Director of Nursing here for Home Health and Hospice at Charlin Health Services, aka Supermom, aka Superwoman, aka my best friend, told me when I was dating her in college that she wanted to be a hospice nurse. And I was like,
what? Bro, what are you talking about, man?
I had no idea what hospice nursing is. I couldn't even think about it at that time because I was playing soccer and I wanted to be a professional athlete. And she said, no, hospice is beautiful. If it's done well, you can really be with patients and families at the end of life and help them pass with dignity and respect. And I was like, interesting. So she's the best person to talk about hospice. So I said, let's chat. This podcast is meant for you if you are a healthcare worker or a healthcare clinician, a doctor, a nurse who sometimes doesn't have the time to explain hospice or palliative care to families. This is a great reference that you could use. If you are a patient yourself or you are one of a potential patient that's needing hospice or palliative care, this is a great one for you. So this will be part one. There'll be a few other parts. And also what you can do on the bottom is click through each section and pick the topics that you want to just listen to if you can't watch the whole thing. I think it'll be a great resource for you. But with no further ado, this is hospice versus palliative care. Enjoy. Hi.
Hello.
How are you?
I'm good. How are you?
Good. My name is Charles.
Get up.
Well, Evelyn, thank you for... Actually, we're going to do this a lot, so I think this is going to be pretty cool that everyone will get to see a little bit of the insides of what we do here at Charlin Health Services. But I think the heart behind this is just really to educate people and help them understand, like, what is healthcare at home?
For sure.
What is hospice? What is home health? What is palliative care? What is VA care? So really, we literally just turned on the camera. You just had a long day. You just admitted 2 patients, and we're just talking. So one of the things we wanted to talk about that we hear a lot all the time is the difference between palliative care and hospice care. Mm-hmm. So if I didn't know anything and I was a gentleman that had an issue with his mom not doing too well, what would you advise me if the doctor said hospice and I'm like, I don't want to give up? Like, I don't want my mom to give up and my mom doesn't want to give up. Like, what would you say? Like, if the doctor just said hospice, evaluate and treat, and I'm like, what? What would be the first thing that you would say to me?
We actually get that call quite a bit. People call to the office and they say, oh no, our doctor wrote an order for hospice. I don't think we're ready for it. Just need to understand what it means. A lot of times I start the conversation of asking them, like, what do you already know about hospice, or what do you think you understand about hospice? Because I like to get a baseline before I start talking at somebody. But I also want to know kind of what their basic understanding is, because I don't want to demean them or anything else. It's a really fragile space, obviously, so, conveying compassion throughout the entire conversation of explaining, I'm really sorry you're dealing with this. It's a challenging space to be in. I try and get a picture of what their home environment looks like. So where does the patient live? How much support do they have? Is this their only family member, or does the son have a wife and the children, whatever else? Like, what's the home environment look like? Yeah. To really set the patient up for success too, so that I can best support the family and the patient. Hospice is just as much for the family as it is for the patient, because it's a very holistic approach. I just spent a lot of time explaining this to somebody yesterday, is that hospice is here medically for your loved one, but also very emotionally to walk you through physical, spiritual, emotional, holistically. What does your journey look like? Because this person will pass on, but you are still left behind. And what does that leave you with? What are you walking through? And that's the beauty of hospice. Is not just medical, it's the social work, it's the chaplain, it's the volunteer, it's the aide, it's the case manager, understanding your situation and really customizing it to what you need, basically.
What do you say to families when they say, I don't want to give up? What does that mean when clinically everything kind of looks like they're going down the path where they need to start thinking and shifting their mind? Like what do you usually say to families like when they say, I don't want to give up? I feel like hospice is giving up.
I get that question all the time because people do feel like hospice is so finite, right? And I think one of the things I say all the time too is that hospice needs to be rebranded completely because I think that people in general have the wrong idea of hospice. So a lot of times people say I'm not ready to give up because they think it means like just letting whatever happen and just not even treating things. So that's a common myth.
Starve.
Yeah, like that's a common myth I have to break on a daily basis is I'm not letting your loved ones starve, but I'm also looking at quality of life. Like, is your pain adequately controlled? If you're not hungry, who's making you eat? You know, there's things that our body as it's declining is telling us physically, and it's our job to decipher like, hey, food is love, yes. Like, don't get me wrong, but your loved one doesn't need food right now. Having those conversations of like breaking down, like, what are those specific symptoms? What is the disease doing to this person's body? How is it changing their body, their chemistry? If it's a mental disorder like Alzheimer's or dementia, like what is that person's physical body showing us that their mental capacity cannot explain in words to us? So yeah, I don't like to use the word never give up because I genuinely don't feel hospice is giving up. I feel like it's giving a person the chance to live their best life with the little bit they have left. So I have hospice patients for 2 years. I've had a couple of them, and gosh, I love them. And one day when they pass, I will be a wreck because they feel like family to me. But at the same time, I mean, everybody's hospice journey looks so different. Yeah, it does. Yeah. It's like, I think a lot of families think, and it's crazy. Like, I know we all saw that Jimmy Carter went on to hospice, and he's living his best life. Oh my gosh, it's crazy. I'm so happy for him. Yeah, and it's crazy because I think, like, even with Jimmy Carter, like, when it's crazy how the thought of hospice, people think they're just dying right away. Like, when everyone was alerted earlier this year that he was going on to hospice, everyone was like, oh wow. He's gonna die tomorrow. Yeah, he's gone. Yeah. Like, and that can happen, right? Like, it definitely can. But we don't know, right, when someone's gonna pass away. So it doesn't mean like they're gonna pass away right away. It's actually just making sure that they're prepped well, right? They have family around. You have social workers and everyone. I think it's crazy. I like how you said like it needs to be like rebranded hospice. And that's where I think that's why people talk about palliative care. And so like, what is that? Like, how do you differentiate between palliative care and hospice care? Right. So palliative care is tricky. So hospice is palliative care. Palliative care is not hospice. So palliative care is comfort measures, right? So when a person is receiving palliative care, they could still be going back and forth to the hospital. They could still be on home health. They could still be even in a rehab or in a skilled nursing facility or something like that. Getting chemo treatments. Yes. So there is a palliative form of chemotherapy at times. Just depends. I mean, every cancer is very different. Every cancer treatment is very different. Every oncologist has their own ideas. That's a whole nother conversation. But yes, there is palliative chemo. So that's not it's not electing the hospice benefit.
Mm-hmm.
So I like to explain that when a person comes on hospice, Medicare will put them into this umbrella of, you are under this specific space of like, you're getting this XYZ, from the hospice, basically. Palliative care is not within that umbrella. So it is, but it isn't. Palliative care isn't like funded by any government organization.
Right now, I guess.
At least at this
down
point.
the road, yeah.
It could be. Let's all say our prayers.
Yeah.
So right now, like, we have patients on home health that are receiving palliative care because we know that within a month to 2 months to maybe 6 months, they will be hospice patients. But the family is not ready to choose hospice. And the reason it feels very finite is because hospice makes you give up your doctors, gives up your specialists. And yes, that's a negative to it, but it can also be a con or a pro. It can also really improve their quality of life by not going to 16 different doctors. And I mean, I've met some patients who I'm like, that's your full-time job, is going to your 8 different specialists
every week.
And it's obnoxious. But
cardiologist, oncologist, pulmonologist,
neurologist, rheumatologist,
and then
all the ologists.
Internal medicine doctor, your PCP, and then you got to make sure you check on your grandkids, and then
it's a whole thing. It's a lot. It's a lot. So palliative care is electing things that are only providing you comfort, not necessarily treating the problem. Hospice is very black and white symptom management versus treatment of new problems. So I like to explain that hospice is not finding the source of those problems ever. And even on palliative care, you're not finding the source of the problem. You probably already know the source of the problem.
Right.
But it's not doing extreme measures. So, and even that is a complicated thing because, when we're doing advanced directives and wills and all that good stuff, that gets complicated.
Yeah.
So
I think the word palliative care is just, it just sounds softer than hospice.
It does.
I think when you hear the word hospice, you think of like, okay, death, right? But when you hear palliative care, you're like, what's palliative care? I don't even know what that means.
Yeah.
And then it's like, oh, that sounds nice.
So there are a lot of patients who, like, this one I admitted today, she's like, can we use the word palliative, not hospice? Yeah. And I said, sure, why not?
Yeah.
Okay, I'll call it home health if you want me to.
Yeah.
I don't care what you want to call it. That's fine.
Yeah.
But yeah,
and then the crazy thing, I think there's been a lot of like bad stigma. Like there's always bad apples, right? There's always bad apples in every industry, right? So like, if you're hungry and you want something to eat, right? You can go to a Chick-fil-A, right? You can go to a Chick-fil-A that's here, or you can go to Chick-fil-A that's in like five miles down the road. It may be managed differently, so you may not get the best service, but Chick-fil-A is Chick-fil-A. I think the same thing that everyone don't understand is that hospice is the same.
It is.
Like it's it's funded by Medicare, right? And so there's these constructs that every hospice is the same. They have to abide by the regulations of Medicare and by the state. But I think a lot of families don't realize is that doesn't mean that each hospice is the same. One hospice may be run differently, just like one Chick-fil-A is run differently than the other one. And then another thing, I think one of the things that families don't understand is they have the right to choose, right?
They do.
You can choose whatever hospice you want.
They do.
You can interview a hospice. You can see if it's a good fit for you. I think sometimes when, and you know this and you see this all the time, is when you're like at the last minute getting hospice, you don't have the time to really sit back and say, okay, all right, mom needs this. Okay, let's look at these hospices that I've seen in the area. Let me take a look, right? You're not in that frame of mind. You're really like it's like last minute, and you sometimes get thrown into a hospice.
Yeah.
And I think that's why palliative care is a beautiful thing, because it's kind of like, okay, let me just see what's going on with my loved one. What do you think, just from your experience as well?
Yeah. I would agree with all of that. Yeah, it's a it's a challenging space to be in, for sure, to make that decision. And generally, when our patients are coming home from the hospital, specifically when it's a hospital discharge, those patients are very sick.
Yeah.
And usually they get home and, oh man, most of them die within a week.
Yeah.
And it's traumatic.
Yeah.
It's hard. But the reality is we're guests in their home.
Yeah.
We barely had the time to build a relationship and for them to feel comfortable with us.
Yeah.
And that's never what we want. We want to be there for you and build a relationship of trust, so that you know that when I'm giving your loved one medication at the end of life, that you're not questioning, like, is she over medicating? Like, why is she giving all of these things? It's like, you've trusted me with your loved one's care for this amount of time. You know that my heart is not to over medicate. But again, just like with any relationship in any area of life, it's like time. It takes time. And so when those rapid decisions happen at the end of life, there's always that guilt. There's always that, what could I have done differently? Yeah. Where did I go wrong? When should I have stopped? Kind of questions. And that's what we try and prevent. But again, it's your decision. I mean, it is a big decision. Yeah. It's accepting the reality of your loved one has a terminal illness that will never get better, and it will cause their demise at some point, and that's hard. It's a hard pill to swallow.
Yeah, it is. I think it's hard too because we don't think about death. Like, I think what they say: 3 things are certain: birth, death, and taxes, right? Like, that's like, those are the 3 things that are certain.
Who came up with that phrase?
Yeah. I don't know either, but it's true, right?
It is true.
Those are the 3 things that are certain, and you prepare for all 3 of them.
Mm-hmm.
You prepare for your taxes, right? At the end of the year, and you prepare, you get a baby shower ready, you get all these things, and then same thing with death, but I think we neglect death.
We do.
But that's gonna happen. And I think it's just so important that, we honor every phase in life, and I think that's what hospice was really made for by Cicely Saunders.
Yes.
Right.
Yes.
And I don't know if you can give a little rundown if you feel comfortable, but Cicely Saunders.
I mean, so Cicely's our mother, right? She started the hospice movement, or began the modern hospice movement. But I joke all the time, which is a really bad hospice joke. But I joke that she'd roll over in her grave if she saw how people view hospice these days, because it is so sad. That people, don't want it until the very, very end, when it's like, there's nothing left of this person. Yeah. Like, I'm taking care of a shell of a human being already. And those are heartbreaking for us too. Those are the challenging ones, honestly. Like, those are the days when we go home and we're like, man, did we give it our best? Because, it's just a challenge. But that is my mantra. It is the reason I went into hospice, is that I truly, truly, from the bottom of my heart and with every genuine bone in my body, that believe that death deserves as much attention as birth. And having 2 children myself, it was a joyful experience. It was something to be celebrated. It was, so many people prepared me for it, walked me through the process. My OB was there with me. Obviously, you were there with me. You were my support system.
I was there, that's right. I'm just kidding.
But I mean, like, death should be the same thing.
Yeah.
I think that there should be people surrounding you and explaining that this could go 15,000 different ways. There's a million different scenarios, but a lot like being on a plane, going through turbulence. I don't know how to fly a plane. Like, I want a skilled pilot to get me through that turbulence. I want a skilled person to get me through the turbulence of watching my loved one die, because it could be smooth, but I will say less than 10% of our patients die without any intervention, because death is painful. Yeah. And I think having somebody there to walk with you through the turbulence of what will happen is such a valuable asset. Yeah.
I think it's more, man, I think from, over the years, us seeing families, so many families, I think it's more of keeping the family less anxious. Mm-hmm. And I think, like, having less anxiety just by knowledge. Yeah. Like, knowledge is power. That's one of the main reasons why we wanted to do this, is to just spread the information, right? Mm-hmm. But because that gives people, like, less anxiety, which then you can truly focus on your loved one at the end of life.
Yeah, we want you to be, like, the true loved one, not the caregiver.
Yeah.
It's hard. Yeah. I mean, our patients are, I compare birth to death all the time. Our patients get to a place where, you know, they need their diaper changed.
Yeah.
They don't eat very much. They sleep all the time.
All the time. Yeah.
You know, it's a process of how do we get this patient to take a medication when they can't swallow pills anymore? You know, all those things. It's like, those are very similar to what a baby needs.
Yeah.
And so it's a lot of work, and it's navigating territory that nobody ever feels prepared for. So
it's tough. It's tough. Any last kind of closing words regarding palliative care and hospice care? And if you're a family member and you're someone that's like, you know, trying to go that route, or you get what would you recommend, or what would you advise anybody? Just the first thing that you would tell someone.
Ask questions. Don't be afraid to ask questions.
Yeah.
I think, you know, if Google is a great search engine, but you know, bigger is not always better.
Yeah.
Sometimes that does put families at ease to know I've got a staff of 100 plus, you know, nurses who are gonna be there or whatever. But, you know, there's always 31 flavors, right?
Mm-hmm.
There is, like you said, one Chick-fil-A is not managed like another one.
Yeah.
One hospice is not managed like another one.
Yeah.
I think if you can meet and know the hearts of the team that's going to be taken care of, ask questions. Ask who's going to be your nurse. Are you going to have 6 different nurses? Who's going to be your aide? Who's the social worker? Who's the chaplain? What kind of experience do they have? What do their other families say about you? You know, all those things are good questions to ask, because I think that they set each hospice apart.
Right.
Ask for somebody, a rep, to come out and do a hospice 101 with you.
Or Zoom nowadays. We got Teams calls, Zoom calls.
Yeah.
You can do those with different hospices. Yeah.
Yeah, I think if you could put a face to a name, it's I was going to say rememberable. That's not a real word.
Rememberable is a good word.
It's memorable, and it helps you feel comfortable in your decision.
I think we should coin that word. Rememberable. Rememberable. I like that.
I don't know about that, but
It's fine.
whatever.
That's awesome. No, that's great.
Yeah, ask questions. Being a medical power of attorney is a really big responsibility.
It is. We should do another one on that later.
Maybe that'll be our next episode.
Yeah, that's true.
Yeah.
Well, thanks for joining us. If you guys liked this, please like and subscribe, and we'll do a whole bunch more of this to help families and you guys make informed decisions with healthcare at home. We gotta go. I'm hungry. What do you want for dinner? Or should we order something?
Need to do something.
You guys.